Welcome to another edition of Grace Under Pressure, where my guest today is Dr. Joel Salinas. I'll tell you all about Dr. Joel in just a moment. Grace Under Pressure is that show that deals with what's too often dismissed as the soft stuff, the caring, the commitment we exert toward others. And when you do it with the purpose of bringing people together and helping them heal, you do it with a spirit of grace. And today we're going to explore that topic with Dr. Joel Salinas. Welcome, Doctor. So,
Thank you. Thank you. Really thrilled to
I
be
want
here.
to tell I want to tell folks all about you. You are a behavioral neurologist and clinician at the Grossman School of Medicine, NYU, the chief medical officer at Isaac Health, and the former Harvard Medical School faculty. You're the author of two books, The Mirror Touch, Memoir of Synesthesia, and your brand new book, which we'll focus on today, Conflict Resilience, Negotiating Disagreement Without Giving Up or Giving In. What a great topic. Welcome, Dr. Joel Salinas.
Yeah, I'm excited for this conversation. Thank you again for the invitation.
I have had a number of guests on my show. It's running almost 5 years now, speaking about the topic of resilience, but I haven't heard it framed in the context of conflict. And since we're in a world of a lot of conflict, explicit and implicit, yours is a great topic. So can you describe quickly what is conflict resilience? How do you describe it, Dr. Joel?
Yeah, so when we talk about conflict resilience, it's very specifically meant to differentiate it from what we typically think about with conflict, which is conflict resolution, which is the idea of resolving the conflict, of kind of finding some kind of a solution to end the conflict. Whereas conflict resilience accepts that we may not always get to a resolution to all conflicts. Some of them are related to differences that we just can't get rid of. And so the idea of conflict resilience is about developing the mindset and the skill set around being able to sit with the discomfort of disagreement and to potentially, ideally, grow from it.
Right. What a powerful thought. And boy, do we need it now because we
Yes.
are in this polarized society. Now, you bring a special expertise to this. You, first of all, are a behavioral neurologist. So you study both brain and brain chemistry and psychology and psychiatry. So it's all woven together. But you
That's right.
also you were a patient. You suffered from an episode of synesthesia. Do you want to tell us what that is and what you learned from it, Dr. Joel?
Yeah. So synesthesia is uh, a trait or a neurological difference around the blending of the senses. That's about as briefly as I can put it. But essentially, synesthesia is something that a proportion of the population may experience. We all have it actually up until about age 2 as our brain is maturing. And it gives us a lot of insights into how our brain processes information. So someone with synesthesia might hear the sound of a violin and experience the color blue,
Mhm.
or see the letter A and see the color red over the A, or many different combinations. But the idea is that there's a blending of those senses. It's a little bit of like a psychedelic experience,
Mhm.
but it's just naturally part of the day to day. And for me, it was really important. One, when I first learned that I had it, I had described kind of my experience to a colleague who was in neuroscience. I described it as if it were very normal, and they said, actually, that's not normal. That's not what everybody experiences.
Yeah.
Um, and that's what led me down a journey to really learn more about what synesthesia is, to
Mhm.
be studied by neuroscientists, and it would really help to propel me to just dig deeper into kind of what makes us human, from the
Mhm.
from the perspective of the brain. Like, why do we think what we think, feel what we do, and do what we do? And it really has been a strong influence in a lot of my own research and how I think about kind of patient care. Just really always having an appreciation for just huge differences in perspective that we can all have, and also having a lot of humility for the complexity of the brain and how it can dictate how we react and feel the world around us.
It's interesting. And being that sort of having a condition, which I don't apparently has not slowed you down because you're an accomplished physician and author. But you still have an insight into, as you mentioned, this difference. So let's jump into the conflict resilience, if we will. And there's three things I think that you advocate throughout the book is naming it, exploring it, and committing to it. So what does it mean to understand your relationship with conflict? I don't know that many of us embrace that, but how do we come to some kind of understanding, Dr. Joel? So,
Yeah, I mean, I think one important piece here is just becoming aware of how you are perceiving conflict. There's this, what we talk about in the book is this concept of conflict tolerance, which is made up of two sub elements. One is
mhm,
conflict recognition, and the other is conflict holding. The conflict recognition is really just how different people can perceive different situations as kind of high or low, kind of distressing disagreement. So for some
mhm,
people, a political debate can be really fun. Like my co-author, he loves kind of
mhm.
debates. He's a lawyer. Whereas myself,
A lawyer and a
yeah,
doc in one book. Now
yeah,
that's a great combination. And your
right.
doctor and your partner, your writing partner is Robert Bardone. Is that it? Yeah,
Yeah, Bob Bordone. Yeah. He's
yeah.
a negotiations expert. He's a lawyer. And as we were writing the book, I would look back and say, we there were so many different things we had conflict about, and I'm glad that we were able to work through them. And he was like, "Oh, we had conflict," um, and I think that that's an important thing to distinguish because for people that you relate with, some people may be very, very attuned to disagreements and the distress of conflict, and others might not. And so for you, what might feel like a potentially relationship ending situation to the other person, it might not. So that first piece is the awareness of the
Right.
kind of your own recognition of what is and what is not kind of high or low degrees of conflict. And the second piece to that is this conflict holding. So it's just your ability, your capacity to kind of really sit with that discomfort. So for some people, even the slightest disagreement can be very, very uncomfortable. For example, like, you know, we want to go out to dinner. I want to do Chinese. You want to do Italian. For some people, that can be really distressing, right? That can raise those distress levels. But for other people, it might not. Whereas, big conflicts like, whether we should sell the company or not, for some people, they can kind of enter into that kind of very, very kind of cool, calm, and collected, or other people that's not the case. And so it's important to note that different situations, different times of day, different context, people that you're engaging with can have a different makeup, but just being aware of that starts to get your brain to kind of redirect and really pay more attention to these differences, which, I like to say that awareness is more than half the battle when it comes to
Mhm.
this. Because the more aware you are of just like what your own kind of perception of conflict is and of how you're feeling or experiencing that conflict can already help to make it easier for you to one just tone down the level of intensity of that conflict,
Mhm.
but also to figure out for yourself like what are the conflicts that are most tricky for me to be present for and which ones are not. So for some people that might be they can engage in like a real high stakes negotiation, like a hostage situation, but really crumble when they have to figure out what's for dinner with their partner. Um,
Now that's
right?
one I haven't heard before.
Yeah, yeah.
Now, what would cause that? I mean, is it because of the emotional investment, one with a partner and one with an abstract situation per se? Is that what's happening, Dr. Scholl? So,
Yeah, I think it's helpful to think about what's happening in the brain in these situations, and it's also helpful to think about just how our brains evolve. We've got 100 billion neurons with 100 trillion connections between those neurons. It's very, very complex, but overall, our brains really evolved to be more than anything a fortune-telling machine, really to make predictions about what's going to happen so that way we can take action to avoid potential danger and to help us survive. And what our brain does with experiences, it records information. For many of us, our experiences go back to with conflict, like around our parents,
mhm,
like a lot of childhood experiences. So if
sure.
you kind of grew up seeing conflict as a very negative thing, as a sign of failure or a sign of something's not working, you may be much more attuned to like to conflict being something threatening, and your brain may actually activate these areas of the brain that are involved in perceiving physical pain, like the same parts of the brain. And so it varies from person to person, but a lot of it is really informed by your past experiences.
Right.
That person who can handle a hostage negotiation, but not kind of talking about dinner with their partner, they might have had some really negative experiences in their family or a past relationship or a past marriage, that feels just like really, really intense and potentially catastrophic to them. But they don't feel that same level of distress when they're in something that for somebody else might seem really, really,
Right.
really intense.
Great. Let me ask you a question here. We are all different people. We we react differently, but similarly in things. Biologically or physiologically, do we experience chemically or physiologically conflict the same way, or are we, quote, in my lingo, wired differently? How does that? What's the perspective, Dr. Joel? So,
I think that there are some things that are similar, and I think there's many things that are different. So when we just think about the overarching parts of the brain that are involved in kind of perceiving a potential conflict and how we register it and label it, those are similar brain areas. So we have kind of the parts of the brain that are involved in sensory functions, right? Hearing, seeing,
mhm,
feeling, but those areas then kind of come into contact with parts of our brain that have past memories, and all those memories have some kind of a labeling or coding to them. We can kind of see something as disagreement or big conflict or big threat, and those things pass through other parts of the brain that are involved in what we call salience. So these are attention related parts of the brain that kind of point you to where to look at, what to pay attention to, and the areas of the brain that are involved what we call valence, which is the positivity or the negativity of the experience. And that's those specific elements. That's where it gets much more different from person to person.
okay.
Some people may have a limbic system that's very what I would call almost like irritable, where like even slight things can get them really riled up. Right? They need to be very
You're not talking to
attuned.
me, are you? So,
No, 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 not at all. But there are people who may have had really positive experiences with conflict. They've always like they grew up in a household where everybody debated. Actually,
mhm.
openly engaging in disagreement was a sign of affection, and so to them, they might be a lot more of these reward systems in the brain, kind of linked to conflict, and so they may be more oriented to approach it. Or others, it'll be totally the opposite.
Right. I think what you're getting into now is this sort of the next step, the exploring. And you introduced the concept of bravery. What does bravery have to do with conflict, and how does that how does that manifest itself, Dr. Joel? So,
Yeah, in exploring, I mean, we always want to think about it becomes very easy with conflict to always put a lot of the blame on the conflict of the person across from you, right? The other person
right,
across from you is the problem, right? They're obstinate, they're not paying attention, they're irrational, they're illogical. But I think it's important to really focus on that which you have control over, which is yourself, and really doing a lot of the internal work around conflict, which is understanding kind of any issues of identity that you have, any conflicting kind of tensions, any conflicts that you have with yourself with these types of situations. Like the part of you, like in a situation about like asking for a raise, there's the part of you that wants to advocate for yourself, and there's a part of you that wants to be a good employee that doesn't want to cause trouble. Um, and that can lead to some emotional turmoil. So that's one piece of that exploration. But another more practical one is what we call really deep listening. It's just like becoming much more curious for the perspective of the other person, understanding that um, in that listening process, you're not necessarily endorsing the other person's point of view. It's really just so that way you can better understand where they're coming from. So that way you have you're much better equipped to respond in a way that better aligns with what you're looking for. And
right.
the bravery piece specifically is reorienting yourself to really see that there might be something more valuable than just paying attention to the fear of that engagement
Mhm.
that will allow you to really sit with it.
Now, we live in an age of not just misinformation, but disinformation. And there are people who swallow that whole cloth unquestioningly. That becomes, as you would say, perhaps their identity. So, um, and that can cause a polarity between people. So, if you have someone in your family or an associate who is believes something completely different than you, how do you listen? So, well,
Yeah, I mean, there's some hacks that we share in the book, that can make it more helpful. I think one thing that I always like to bring up that's just so important is just pausing and breathing through it. Right. So there's actually some specific breathing techniques that are really closely tied to reducing stress and
mm,
anxiety. There's something called cyclic sighing, but essentially you take a deep breath in through your nose and then you do like a quick little top off, inhale at the top, and then a long, slow exhale. And doing that for about 5 minutes, actually, there's a lot of really great research around this, how it helps to slow your heart rate, your respiratory rate, can lower blood pressure. So it really can be quite effective. But
would you do that breathing prior to meeting the person or during the conversation? So,
both, I think both. I mean,
okay.
you certainly want to make sure that you're doing it in a way that makes sense. Right? You don't want to
Yeah.
exaggerate
Yeah.
that you're putting up with them because that might set them off. Uh,
Right.
but I think helping to manage that anxiety prior to the engagement can actually be a big help because oftentimes our fear of potential outcomes of the engagement may actually be greater than the actual engagement itself. And that's a
Right.
common piece of feedback that we get is people say, actually, my worrying about engaging in that hard conversation was actually more painful than the conversation itself.
Right.
Um,
Now, there's a point on this, and quite lower stakes, but personal to all of
mhm,
us, is the workplace. Okay, so let's say
yeah,
you and I want to do project A, you want to do project B, and we go see our boss. So we are pitted as rivals, or we evolve as rivals. And so I know that I'm just going in there and I'm going to go, I do not like Joel, and I don't like his ideas. So how do I keep it together? So what's an act?
yeah. I mean, one of the pieces of advice we give around that listening through that situation is to one, we always think about what are your purposes. So, like, what's your purpose behind that dialogue? What's important for you? What do you hope to get out of it? That way, that'll help to dictate kind of the time, the setting, what topics you cover during that engagement. Um, but also help to kind of attune your listening in that conversation to focus, like align it with the purpose. Um, the other piece there is, you know, as you're engaging with the other person, when you're trying to listen to them, think about it as I mean, everybody has their own kind of visualization that can be most helpful for this. But for some people, it's just imagine like you're a journalist, right? And you're writing and have a huge profile on the person from across from you. You're going to write that Pulitzer Prize winning piece. So listen with that kind of journalist kind of mindset, becoming really curious about not just um, hearing what they're saying, but really listen for what is informing their point of view. Um, and there's this other instrument that we talk about. It's called the ladder of inference. So if we think about kind of the headline of what somebody is saying up top, and what you want to do is slowly work your way down the ladder in terms of like what are the situations, the past experiences, like the milieu of data that led to that headline can help you really understand where somebody's coming from and that process in and of itself, and this is like really key for people who have very extreme points of view, can be really helpful um, to attenuate how extreme those views might be. Um, and it helps you really understand what motivates the person across from you, and that ends up being really advantageous to you when it comes to the next step, which is what we call effective assertion, which is really kind of bringing your point of view into the conversation, and also just feeling better equipped to make sure that you're able to have your voice heard in the conversation makes it feel less threatening to listen to the other person, knowing that you're not endorsing them and you'll still be able to get your point of view kind of and your kind of thoughts, feelings in this conversation, like your interests really heard here.
Great. Now, when we think of the topic of conflict, and in your third point about we've explored naming, exploring, becoming brave, commitment, and you use the word collaboration. Now, when I think of conflict, I don't think of collaboration. So, how do we how do we train ourselves, or what's the mindset that will enable us to be collaborative?
Yeah, we think that it's really important to um, begin, and then this is kind of part of that awareness, is begin to reorient how we process conflict and think about it less as, again, failure, a sign of weakness, things not working, and see it more as an opportunity for creativity, an opportunity for innovation, really thinking about what will come out of that. And that's where it becomes much more collaborative. The idea that your point of view being kind of brought into conversation with the other person's point of view can actually help to refine kind of either kind of what you're both working on, where you have mutual interests, or even kind of your own thinking around this. And it may influence the other person as well. There's a strong likelihood that it would, even if it's not really apparent. But in this dialogue, it's just almost impossible to um, not have some degree of kind of change going on. That's where that ability to kind of work together to get to a new place is important. And we do want to make sure that, again, this is where purposes comes in again. Is like, what is the purpose of the dialogue? And so, for example, if you're having a conversation with a teammate who thinks that we should invest in project A, and you feel like you should invest in project B, that conversation can really inform you in terms of like, okay, what are the potential objections to project B that I should be thinking about, taking as an opportunity to learn, and also maybe help you identify what are the interests of the other person for project A, and maybe help you figure through, what am I missing when I'm talking about why project B is important, that could meet the needs of the other people in the group that might not necessarily be aligned with it.
Now, thank you. Now, as we explore this topic and concept of conflict, there are we describe as psychological barriers to understanding or to dealing with conflict. And so, in a sense, we jump to the negative first. Something my wife has said to me on more than one occasion. so,
Hmm.
so how do we explain it, and then how do we guard against it, Dr. Joel? So,
Hmm. So how do we?
in the sense of I'm going to meet with you, and I know you and I don't get along, so I'm thinking the worst possible scenario. So
Ah,
what should I do? Yeah.
yeah. No, that's an important point, and we want to make sure that when we're talking about conflict resilience, that it's clear that we don't want conflict resilience to be conflated with enduring a really harmful situation, right? A situation that really has a real threat or potential risk to yourself. um, we really are focused on is disagreements that we can potentially work through to help to build things together. But in the book, we do talk about this point about knowing when to stay and work through it and when to walk away. And in that piece, one thing that can help to kind of summarize is really coming to terms as to whether the other party is acting in good faith,
Mm.
because that can be really helpful to you to understand, is this person here to have this dialogue with me, or is this really an exercise in futility together? And then comes the bigger conversation. If I need to walk away, is there something that is worth salvaging here? Is there some way that I can still have my interests met even if I'm moving away from the situation? And if you just decide to stay, then great, then you get to work it. But maybe there are some changes that you need to make about your approach, or kind of some boundaries that you need to set going forward, so that way the conversation can continue to be productive.
Okay. I think you raised a very important point, and as a behavioral scientist, there are some situations where unwinnable, and particularly there can be harmful situations. I can think of couples or all
Hmm.
kinds of situations. So it's no one to fold them, if you will, and walk
Yeah.
away with a sense of keeping your self-esteem at minimum. Are there some tips on that, Dr. Joel? So yeah.
Yeah. I mean, I think one of the ways that we see the process of developing these skills is a little bit like how you would do weight training. You don't want to jump in, if you've never done weight training before, to the heaviest weights and the most complex kind of repetitions. You want to start with something a little bit more straightforward. So we want people to really start with conflicts and disagreements that don't lead to that much distress. And you can kind of give yourself a rating from 0 to 10 about how much distress it gives you. 0 being no distress, 10 being the biggest distress possible. And really identify those situations where the distress level is something along like a 2 or 3. And then kind of practice these skills in those like those conflicts are a little bit lighter. So that way, as you gain familiarity with it, as you become more aware of it, as you're practicing the skills of deep listening and effective assertion through that, you can then move on to the next level of challenge in that. But certainly, we wouldn't want somebody to go all in on something that causes like distress level of a 10 outright. And sometimes it's really a matter of making sure that you're protecting your own well-being by kind of working up to it. And what I think it's really important to just acknowledge sometimes when there are certain types of situations that are really, really challenging. And that can sound like just saying up front at the top of the conversation, saying, conversations about XYZ are really uncomfortable for me. It might be important for us to kind of pause sometimes, and I'm going to need a little bit more time to think through this. I mean, up front, we may not resolve this within this one session, but I want to continue to have this conversation over time because it's really important for me to continue to keep this relationship, or really important for me that we work together really well. Something along those lines. And I think one of the other things that I'll just bring up around kind of the last step of commit is it's really figuring for yourself, again, this kind of whether you stay or you go, and really making sure that you stick with it, and know that your decision that you have right there in the moment isn't kind of is something that you've kind of decided it for your own interests and your own values, that it's worth to make that decision for yourself. But it is a process that takes time and takes practice, and we're hopeful that by kind of learning about these topics and kind of being aware of them as you're engaging with disagreements, that'll slowly start to help you develop these skills. But at a bare minimum, the smallest, lightest thing that you can do if you or want to try to develop any of these kind of skills today would be to focus on that awareness piece, is really just becoming aware of how you're physically feeling whenever you're in a disagreement.
And I liked how you phrased it at the very beginning, being aware and learning the self-awareness is half the battle, if not more. Dr. Joel, we are racing to the end of this show. We could go on and on, or I could. You have a busy
Mhm.
schedule. But as you know, I ask every guest a story about grace. Do you have one that you could share with us from your experience? So,
Yeah, I I immediately think to a lot of interactions that I've had in the hospital with really challenging patient situations. And, in times of crisis and times where we're really talking about life or death, um, it can be such a boon for kind of the team and the people that you're working with, but just for yourself to kind of work to develop that sense of grace, because it helps to provide clarity when there's just so much going on all at once. It's we can become very prone to be swept away by the intensity of the crisis, and coming in with grace can help to level set a little bit more and create that space that we sometimes need to be able to make the best decisions for ourselves.
that's great. I like, and in a way, it's knowing our limits, what we can and cannot do. Would that be fair to say? So,
Exactly.
that's great. Showing ourselves a grace. We often overlook it, but it's so powerful. Dr. Joel Salinas, it has been such a pleasure to have you. The name of your book is Conflict Resilience, available for pre order now. And this show will be watched for years to come, so it'll be on the bookshelves then. So, great.
Wonderful. Thank you so much.
It has been a pleasure to have you. And with that, we will go out.